Hi, class. Today we're going to talk about urinary elimination. So, chapter 27. Make sure that you go to your Evolve account and you watch the skills videos on chapter 27. So, let's get started. Okay, so eliminating waste is a physical need that all humans need to do. The reason we have a urinary system is because we need to remove waste products from the blood. It also maintains our water balance. Make sure that in your book, your Mosby book, that you're looking at the body structure and function of the urinary system, okay? So normal urination, the healthy adult produces about 1,500 milliliters or 3 pints of urine a day. People usually void at bedtime, after they sleep, and before meals. Some people void every 2 to 3 hours. Some people even more often. Some people need help getting to the bathroom. Others use bedpans, urinals, or bedside commodes. So, factors affecting urine production include their age, any kind of disease process, the amount or the kind of fluid ingested. For instance, a cup of coffee is like a diuretic, so it's going to make you have to urinate more. Also, how much dietary salt they're getting. So the more salt, the more we're going to retain, and they're not going to have a big urinary output. Okay. Also, the body temperature and perspiration. So if we're perspiring because we have a fever, we're probably not going to have a big urine output either. Certain medications can increase or decrease urine output. So frequency of urination is affected by the fluid intake, the person's habits, available toilet. Did we check with our patient to make sure that they didn't need to go to the bathroom before we change shifts or etc. Okay. Also, activity, work, and illness can alter the output. All right, so you had to do some terms for me on Blackboard. Let's just review those again. Dysuria is painful or difficulty with urination. Urinary incontinence means involuntary leakage of urine. Nocturia is frequent urination at night. Hematuria, remember from your medical terminology that hema is blood, so it's blood in the urine. Urination is the process of emptying urine from the bladder. Oliguria is scant amount of urine, so that's going to be about less than 500 milliliters in a 24-hour period. On the other hand, polyuria is abnormally large amounts of urine. And then urinary retention is inability to void. So let's see what you remember from that. So which is correct? Let's see what the answer is. Hopefully you got it. Dysuria means painful or difficulty with urination. Okay. All right. So normal urinations, colors. You want it to be pale yellow, straw colored, or amber. We want it clear, so we don't want particles all through it, and it could have a faint odor. Okay. When we're pushing amber, we're looking at maybe some dehydration because it's more concentrated. Okay. So these two are preferable. Amber is starting to get a little bit on the side of being dehydrated. But anyways, so some foods will affect urine color. So red food dyes, beets, blackberries, and rhubarb cause red colored urine. Carrots and sweet potatoes can cause a bright yellow. Certain medications can change urine color, and asparagus can cause a certain odor to urine. Okay. You want to observe urine for the color, the clarity, the odor, the amount, any kind of particles or blood in it. And you're going to report any kinds of complaints of urgency, burning when they urinate, or any kind of painful or difficulty with urination. Okay? So which one of these would be abnormal? Clear amber urine, urine with a faint odor, cloudy urine with particles, or urine output of 1,500 milliliters in a 24-hour period? Let's see. So, yeah, we want that urine to be cloudy with no particles in it. Okay? So, again, I'm just reminding you to go into your Evolve account and make sure that you're looking at those skills videos under this chapter. Okay? So when we're talking about a bedpan, position the patient in Fowler's position when using that bedpan. Bedpans are used by persons who cannot get out of bed, women for voiding and bowel movements, men for just bowel movements. Okay? The men would actually use a urinal if they had to urinate. This is called a fracture bedpan. It's a little bit different, a lot thinner, and a different shape. So fracture pans are used by persons who have casts, a person who's in traction, a person with limited back motion, after any kind of spinal cord injury or surgery. Also, we use them with hip fractures or hip replacement surgery. The pan itself has a very thin rim, and it's only about a half an inch deep at one end. The smaller end is placed under the buttocks. Remember that. The smaller end is placed under the buttocks. So when you are using a standard bedpan, what position should you put that patient in? Right, Fowler's position. Good. So men's urinals are used to, of course, void. The man's going to stand if possible. Some have to sit on the side of the bed or even lie in bed to use this. Some men need support when standing. You may have to place and hold the urinal for some men, so be prepared to do that. Always remind the men to hang their urinals on the bed rails and signal after use. Not to place the urinals on their overbed tables and bedside stands. After they void, the urinal cap is closed to prevent the urine from spilling. The plastic urinals have caps and hook-type handles, you can see in the picture. The urinals will hook to the bed rail within the man's reach. Some beds may not have the bed rail, so we'll have to make other accommodations. Again, please watch the skills videos within your Evolve account. When using a fracture pan, the larger end is under the buttocks. True or false? That's false, so it's the thinner part, remember. Okay, so persons unable to walk to the bathroom may be able to use what's called a bedside commode. Okay? The commode allows a normal position for elimination, so it's a lot easier than trying to do that in bed. The commode has arms and a back support to help prevent falls. Some commodes are wheeled into the bathroom and placed over the toilet. They're useful for folks who need more support when sitting. The container is removed if the commode is used with the toilet. Make sure that if there are wheels, they're always locked when positioning over the toilet. And again, please watch the skills video. Okay, so when we're talking about urinary incontinence, the goal of managing incontinence is to prevent those UTIs, urinary tract infections, and also to try to restore as much bladder function as possible. So there's a few different kinds of incontinence. Something called stress incontinence, which is a loss of urine like when we're exercising, okay? There's also something called urge incontinence, which is a sudden need to void. All of a sudden, it just comes upon you, okay? There's overflow, which is leakage due to a bladder that is always full, so that bladder is not emptying quite right. And then there's functional incontinence. cannot get to the bathroom in time. The main cause is those unanswered call lights. So this is the one where you went off to lunch and didn't check on your patient to make sure that they, if they needed to go to the bathroom, they can't get up on their own, and they have they become incontinent. Okay. Also, reflex is caused by certain nervous system disorders and injuries, and this is a loss of urine at predictable intervals. Okay. And then some people can have something called mixed incontinence. It could be a few of those above. And then transient incontinence. Okay. If incontinence is a new problem, you're going to tell the nurse. So if this person never had a problem before and all of a sudden is, make sure that nurse knows. Okay, here's a question for you. After using the urinal, the man should let's see what the answer is. Use the call light, right? So if he can, they're going to put it on the bedside rail and use the call light to let you know that it needs emptied. Urinary incontinence is the involuntary loss of or leakage of urine. It can occur in older folks, but it's not part of normal aging. Okay? Older persons are at risk for incontinence because of changes in the urinary tract or because of medical or surgical conditions, and could be because of medication. Incontinence may be temporary or permanent. Sometimes incontinence results from intestinal, rectal, or reproductive system surgeries. Incontinence also may be because of a physical illness or medication. The Centers for Medicare and Medicaid Services require appropriate treatment and services for persons who are incontinent. The goal is to prevent that UTI and restore as much normal bladder function as possible. Okay? Remember, it's embarrassing to folks and it is uncomfortable. We've got to remember that we are interfering when we're not taking care of our patients. We're interfering with their self-esteem. People have pride and dignity, and we need to try to keep that as much as possible. You'll see folks isolating themselves. They'll lose their independence and become depressed. So we have to be on top of it, okay? You may need to give good skin care and dry garments and linens often. Promote normal urinary elimination if possible. We may also have to do some bladder training, or at the last result, do a catheter. Okay. Incontinence is linked to abuse, maltreatment, and neglect. So remember that incontinence is beyond the person's control. If you're becoming short-tempered and impatient, you need to talk to the nurse at once, okay? Because, you know, you've just cleaned up the bed and got everything straightened up, and the person becomes incontinent again. You can become very frustrated with this. You have to be aware of your own feelings, okay? We cannot be short-tempered or impatient with our patients. So remember, that person has the right to be free of abuse and mistreatment and neglect. Okay, what's the main cause of functional incontinence? Do you think it's illness? False. Okay. Okay, so again, you're going to have a skills video on this, and we will be practicing all these skills in Campus Lab, but let's talk about applying incontinence products. We use them to help the person stay dry. Most products are disposable. They usually have 2 layers and a waterproof back. Fluid passes through that first layer and is absorbed into the lower layer, and many products come in bariatric sizes also. When we're applying it, we're going to apply the brief. The used brief is removed from front to back. So remember that. When you're removing that brief, remove it from front to back, and you know why. So if we go from back to front, we could contaminate and cause a UTI. The new brief is opened lengthwise. The new brief is inserted lengthwise between the legs, again from front to back. The back panel is spread open, and the lower tape tab is attached at the slightly upward angle. The upper tape tab is attached in a horizontal manner. Again, please watch the video. Just remember, Take it off from front to back and apply it from front to back. Here's your question, and I just told you, so you should know this one, right? We're going to apply that incontinence product from front to back. Okay, so bladder training, it's in your book, so I do want you to review that. Control of urination is the goal of bladder training. The person uses the toilet, the commode, the bedpan, or the urinal at certain times, okay? The rules for normal elimination are followed. The normal position for urination is assumed if possible. All right, so there's, of course, privacy is important, but there's 4 methods, okay? Bladder training, you're going to ignore the urge to void. So when the urge comes on, you're going to try to ignore it. And that's one type of bladder training. There's also prompted voiding. So you're going to void at a scheduled time. Like you're going to be scheduled to void at 12. You're going to try to void at 12 and at 2 and at 4, etc. Okay, so that's called prompted voiding. Habit training or scheduled voiding is going to void at times to match the person's normal pattern. So if the person normally was going to the bathroom when they first got up, and then maybe before their meals and before they went to bed, we would try to keep that pattern and get them back on track, okay? And then catheter clamping. So this person has a catheter, and at certain times, we're going to clamp the catheter out to engage them feeling full. They'll feel their bladder fill, and we'll gradually increase the time of clamping so that they can actually hold more at larger quantities of time. Okay? So again, bladder retraining, prompted voiding, habit training, and catheter clamping. The goal of bladder training is to, let's see if you remember the answer to this one, gain control of urination. Okay? A person is taught to ignore the urge to void. This type of bladder training is called bladder retraining. Okay, so that's this for this PowerPoint. Now go and do your Evolve review questions. Go to Blackboard and watch any of the YouTube videos that I have posted for this chapter, and also do not forget to do your Mosby, well, actually, your skills videos on Evolve also. Okay, see you soon.